It's about having another tool in the box. And when you realize, okay, condoms are there, condoms are inexpensive, condoms are plentiful, you can get them anywhere. We have condoms all over the building for free, of course. And you realize the incidence rate is still where it is and it's getting worse, then obviously, without even needing to do a deeper dive, you see that people are not using the condoms effectively if they're using them. So, and people decide, well, it's difficult for me to use a condom. I may get caught up in the moment and not have a condom, or the desensitization that comes with using a condom may be there. So people decide, what's another alternative? And so PrEP is an alternative. So again, I just want to reiterate that we promote both PrEP as well as condom usage, not one over the other. But if someone decides to use PrEP, definitely condoms is still the way to go to prevent against the spread of other STIs.
I want to know your thoughts on, just the advancement, with medicine and, the progression HIV has made, 30 years ago.
Right.
It was a death sentence. Now you can pretty much live with it as long as you're good on your meds.
Correct.
Everything is good. What are your thoughts on just the advancements with HIV, and where do you see it in the future?
Well, I think, of course, I'm really excited about the advancement that we've done with the medicine and technology and the testing algorithms, and people are finding out their status quicker, taking a test in 60 seconds as opposed to waiting initially like 2 weeks and then 20 minutes, 15 minutes, and now you can know in 1 minute. So that's great, and I also think it's really super that people have an opportunity to explore other options, to understand that, okay, if I don't use a condom, maybe I can use this drug that will do the same thing that the condom does. But as I mentioned before, we just want to be careful about people deciding to just go straight to that drug usage of Truvada instead of exploring other options. But whichever they decide to do, we just want to make sure we're supporting that. As HIV is what, 36, 37 years old now, and you think at this point it's scarier because people don't really contract. HIV doesn't really turn into AIDS anymore because we have such great medicine and because we do great education and promotion about prevention. So people have this invincibility that when you acquire it, you're not going to look differently, you're not going to behave differently, because it really is a silent killer. Similar to blood pressure, those things are silent. Diabetes, you have to be careful to know still that there are precautions that you need to take, and just more educational opportunities to learn and be aware of what PrEP is and what it is not. And when you think about the generation of maybe having unprotected sex or multiple partners as it becomes more socialized and acceptable, then PrEP makes sense to go there. And it isn't saying, definitely do this to have sex, but it's saying if you're going to, here are some options to help you stay HIV negative.